And we're back. We told you not to go anywhere. Well, let's give thanks to our corporate sponsor that is sponsoring this vignette. It's ChiroUp. ChiroUp is your all-in-one chiropractic software for better care and streamlined practice management. From automated soap notes to efficient scheduling, billing, and patient education, ChiroUp saves you time, access evidence-based protocols for 200 conditions, and create personalized exercise plans. Whether you're looking for enhanced charting or a complete clinical solution, ChiroUp is here to help you grow your practice and improve patient outcomes. Visit chiroUp.com/F4CP to learn more.
Well, last year, during the BioFreeze USA Pickleball National Championship in November, the foundation aired its pickleball commercial 20 times on the Tennis Channel, ESPN, CBS Sports, and other connected TV networks about how chiropractic care can support senior living and active lifestyle. In case you missed it, here it is. Watch it now.
My husband and I are able to play pickleball with our grandchildren because of chiropractic care. It has given us the keys to a healthier, more active life. Chiropractic adjustments help us prevent injuries and keep on top of our game so we can enjoy every moment with our grandkids on the court. Visits ease joint pain, enhance flexibility, and even improve balance. Gain more freedom and joy in your daily activities on and off the court. To find a doctor of chiropractic near you, visit f4cp.org/findadoctor.
Well, today's guest couldn't join us live. We are thrilled to welcome Dr. Joseph Matthew virtually as Chair of Medical Specialties at New Jersey's Valley Health System. He specializes in pulmonary, critical care, and sleep medicine. At Valley Health, it includes all of this at their Valley Hospital, a 370-bed magnet-designed facility with all private rooms, along with Valley Medical Group, which has over 500 providers across 60 specialties, and Valley Home Care, serving more than 12,000 patients annually. Recognized among America's 100 best hospitals by Health Grades, Valley Health delivers seamless, top-tier care. Welcome, Dr. Matthew.
My husband and I are able to play pickleball with our grandchildren because of chiropractic care. It has given us the keys to a healthier, more active life. Chiropractic adjustments help us prevent injuries and keep on top of our game so we can
Thank you for joining us today, Dr. Matthew. It's so nice to have you.
Dr. McAllister, thank you so much for having me. I'm very honored to be here today.
Well, as you know, ChiroThon is about celebrating, elevating, and educating, and this is our moment to do just that. So I first want to just ask you, because you're an extremely knowledgeable individual, we're very blessed to have you. Tell me, what inspired Valley Health to launch an integrative medicine service line at this time?
Sure. Dr. McAllister, as you know, we're at a really exciting time in healthcare right now. Patients are asking for more personalized treatment and really comprehensive treatment. They don't want just symptom management where we put Band-Aids on different symptoms. They really want whole person care. So at the Valley Health System, we saw this as an opportunity to really meet the patient's need by creating a program that brings together the best of traditional medicine, which we already have in place, with evidence-based complementary therapies such as chiropractic, acupuncture, and others, with this whole integrative medicine service line, where the emphasis is truly healing the patient rather than just treating symptoms.
It really does make a difference when we're looking at healing the patient versus, hey, doc, I have this symptom. It's kind of getting back to the defined reason why patients get frustrated is, well, I got the symptom taken care of, but it came back, which means we didn't get to the root of it. Or they're doing this fragmentation of care, which is really unfortunate because oftentimes they either become exhausted and frustrated or disappointed, which means, I don't want to follow up with care because I don't actually know if I'm getting what I need or I need what I'm getting. So there is that reality that comes into play. Can you describe for me, for our audience, a little more about what is or defines integrative medicine and how does that actually fit into Valley Health's mission?
Sure. Integrative medicine, it looks at the patient as a whole. mind, body, spirit. It doesn't replace conventional care, which Valley already provides a lot of traditional allopathic medical care. So integrative medicine really complements our traditional allopathic care with non-traditional care such as chiropractic, acupuncture, where patients can really benefit from enhanced pain management, better symptom relief, reduced side effects, more focus on prevention, where really the patient is at the helm of their care. So when we talk about integrative medicine, to use chronic pain as an example, we're not just offering medications, invasive procedures, surgeries. We're also integrating chiropractic, acupuncture, nutrition, stress reduction. So that really fits in beautifully with Valley's mission to provide personalized, comprehensive, whole person care.
I really like how you string it together to really make sure that the patient really is the center of their personalized care. And as you walk through this, I'm sure there's a lot in this new initiative that you see over the time that you've spent becoming a medical doctor, treating in a facility. What excites you the most about having this new initiative at Valley Health system?
Well, I'm a pulmonary critical care physician, and having been in the field for a long time, I've seen how traditional medicine often falls short of its goal. So as much as we want to help the patient, we can't always do it, and that's where teaming up and partnering with our integrative medicine team, we've really seen firsthand how that improves and enhances the care that we give. So whether it's a cancer patient suffering from pain, or someone with chronic low back pain where conventional therapies haven't helped, we've really seen the true benefits of integrative medicine. And for me, that's exciting because we have something more to offer to the patient than our traditional procedures and medications. And we're partnering with our entire healthcare team to provide the best care for our patients. And at Valley, it's been so well received by everyone. And this is just the beginning. We've just launched our service and already it's become so popular. So I'm really excited about what's to come in the next 2 years, 5 years, 10 years. I think a lot of exciting things ahead for our patients.
It really is exciting because bringing people together to enhance treatment and ensure that the patient feels listened to, that's one of the keys that over time you hear patient satisfaction rate. What are they? And how do you build on those patient satisfaction rates? And it's really the patient being able to be well educated, be able to celebrate that there's a team that works with them instead of feeling that moment of, well, I went to this doctor who doesn't communicate with this doctor, and now I have to make a decision on which type of therapy. What you're really bringing and what Valley Health's mission is bringing towards is the comprehensiveness of that patient care. And again, just so our audience is aware, can you share a little bit about what are the kinds of therapies that patient can expect? And then how does the patient find their way into some of those therapies? Do they get referred by their primary care? Do they get to choose? How does that work in the system?
Sure. So, we just recently did our initial launch of the integrative medicine service. So our program right now offers a range of services, including chiropractic, acupuncture, therapeutic massage. We hope to expand this further into integrative nutrition, counseling, stress reduction, guided meditation, perhaps even functional medicine. So again, this is just the beginning, and our goal is to expand further because the demand has been so high. As you know, each of these therapies is rooted in science. It's delivered by our fantastic team of licensed professionals. And again, the overarching goal is to provide comprehensive and personalized treatment. In terms of referrals of group physicians and advanced practice providers. It can come from a primary care doctor. It can come from, for example, our physical medicine and rehab service. It can come from our pain management doctors. So really, we're partnering up with a lot of team members who refer patients. They get feedback from their patients. And again, no one service is functioning in silos. We talk to each other. We're constantly collaborating. And that feedback basically leads to really the increased demand of these services.
I bet you it does. You start thinking about the way to which a patient may come to any one of these therapies. And I often think about many times they come through the obvious, which is I have pain. And then they start to be educated on the cause of that pain, and then what are going to be some possible solutions to that pain. And what I really love about the integrative portion of this type of treatment is that not only do you come with the ability to get educated, but then you start to move into what I think is kind of like a laddered system. Is you start to alleviate that pain, and then you start to recognize there's a prevention aspect to it. Like a lot of what we do during the day, sometimes if we don't know that it's going to be harmful, maybe it's our lifting technique, maybe it's our ergonomics, right? There's so many things that come into play. Plus, if you currently have like you had mentioned, cancer therapy, there's a lot of chronic pain that comes into it. And we tend to, over time, adopt the least pain strategy, which is if it feels good in this position, even though I know it could be, a problem for me down the road, that hunched over, just feeling like you're trying to avoid further pain, you become almost catatonic to know I don't want to do that because the last time I did it, it hurt. We have to break through these cycles. And the physicians that are working together and integrating into this system is so exciting because they're learning different ways to talk to their patients too. And like you said, they're not in a silo. When they're in this integrative medicine service, they're physicians talking to each other about the best part of that personalized care that I think is being offered. Over the time, since it's just starting up, and like you said, it's going to be fun to see how you can educate and then elevate what that looks like. Maybe today it's alleviation of pain, but tomorrow it's going to be prevention, and then hopefully, and I love your guided meditation portion, maybe it's going to be optimization. Tell me how you see the integrative medicine services being received so far, even though it's not been an extended period of time. How are these healthcare providers having those conversations, and what kind of exciting things do you see as this is starting to take root?
Yeah, like I said, I think the reception has been extremely warm. I've only been at the Valley Health System for a year and a half, and really, I've witnessed a lot of collaboration. The Integrative Medicine Service has been up and running for a little over half a year. And in the beginning, we, took our acupuncturist and our Dr. Nuzzi, our director, for a lot of meet and greets to meet with different folks within the Valley Medical Group and the Valley Health System. And really, the reception has been so beautiful to watch, and the number of referrals. How different services, whether it's oncology or pain management or PM&R, everyone's been clamoring for integrative medicine services. Why? Because I think they realize the benefits of collaboration, and especially when they get positive feedback from their patients, it just leads to further demand. So, even services such as sleep medicine, where a lot of patients struggle with insomnia, they found basic benefits from integrative medicine, from acupuncture. So you name it, almost every physician or every subspecialty service within the Valley Medical Group has been clamoring as some sort of commonality with the integrative medicine service. So it's really been fun and beautiful to watch. So I'm really excited for the years to come as we continue to grow the service.
I am too, because over time, I want to check back in with you. It is a reality that many of us do have sleep issues. And if you had someone to talk to, if you just knew, hey, I have this problem, I could go to the drugstore, but is that really the best option for our patients? And then are we really treating what the cause of the problem is? And then, as you said it, I'm like, massage therapy, like, why wouldn't someone who just being a practitioner like yourself, you're on your feet, the job is stressful, you consistently probably have your own aches and pains that can come up as you're doing the job that you're doing, and to be able to say, I want to prevent further problems down the road. I want to go get, therapeutic massage, or I want to start to learn the meditative aspects of how to heal my brain through the stress of treating patients. Because oftentimes, as you know, you're treating a patient, but you're also feeling their emotions. You're also feeling the stress of the therapy. And if the patient is on the right track and they're getting these types of integrative services, it just feels like a whole being outcome is in the future. And that, I think, Dr. Matthew, is the piece that we can all hope for. So I am excited to watch you grow, checking with you again. And thank you so much for joining us today, Dr. Matthew. We truly believe in the power of whole being health and appreciate the work that you're doing and being forward thinking, and really a motivator and an inspiration to so many other systems that are looking at bringing in and adopting this type of mission into that personalized care and talking about functional medicine. So thank you so much for joining us.
Thank you, Dr. McAllister. Again, thank you for having me. And we hope to pick up a lot of new ideas at the convention. So thank you again.
Fantastic. Well, viewers, please, we'll be right back. Don't go away. We have more to talk about in functional medicine. So come right back. Don't go too far. We look forward to sharing more with you today.
My husband and I are able to play pickleball with our grandchildren because of chiropractic care. It has given us the keys to a healthier, more active life. Chiropractic adjustments help us prevent injuries and keep on top of our game so we can enjoy every moment with our grandkids on the court. Visits ease joint pain, enhance flexibility, and even improve balance. Gain more freedom and joy in your daily activities on and off the court. To find a doctor of chiropractic near you, visit f4cp.org/findadoctor.